Can HIV/AIDS be cured today? Imagine a world where HIV no longer exists in the body. While that sounds promising, the reality is that currently, there is no widely approved cure for HIV or AIDS. Major health organizations like the World Health Organization, the Centers for Disease Control and Prevention, and the National Institutes of Health agree that HIV remains a manageable but incurable condition for most people living with it today. HIV, or human immunodeficiency virus, attacks the immune system by targeting CD4 cells, which help fight infections. If untreated, HIV can progress to AIDS or acquired immunodeficiency syndrome, which severely weakens the immune system. The good news is that with proper treatment, many people with HIV can live long, healthy lives. The standard treatment is antiretroviral therapy, which involves taking a combination of medications daily. These drugs suppress the virus, allowing the immune system to recover and preventing the progression to AIDS. When taken consistently, antiretroviral therapy can reduce the virus in the blood to undetectable levels, meaning it cannot be transmitted through sexual contact. This is often summarized as undetectable equals untransmittable, or U equals U. However, antiretroviral therapy does not eliminate the virus from the body. The virus can hide in certain immune cells in a dormant state, forming what are called viral reservoirs. These reservoirs are not affected by current medications, and if treatment stops, the virus can reactivate and start replicating again. This ability to hide makes curing HIV extremely challenging. Scientists are actively researching potential cures. Some promising approaches include stem cell transplants, where a small number of people have been cured after receiving stem cells from donors with a rare genetic mutation that makes their cells resistant to HIV. But these procedures are risky, expensive, and only considered in cases where the person also has other serious health conditions like cancer. Researchers are also exploring gene therapy, which aims to edit or disable the virus in infected cells, but these treatments are still in early stages and not yet proven safe or effective for widespread use. Other experimental strategies involve shock and kill techniques, which try to wake up dormant virus so it can be targeted and destroyed. While these methods show promise in laboratory studies, they have yet to be successfully applied to humans. In the realm of research, scientists distinguish between a sterilizing cure, which would completely eliminate the virus from the body, and a functional cure, which would control the virus without the need for ongoing medication, even if some virus remains. So far, only a few individuals have achieved a sterilizing cure through extreme medical interventions. A true functional cure remains a goal for future research but is not available today outside of clinical trials. For those living with HIV, the most effective approach remains early diagnosis and consistent use of antiretroviral therapy. This not only helps maintain health but also prevents transmission to others. Using condoms and pre-exposure prophylaxis are additional tools to reduce the risk of spreading HIV during sex. It's very important to avoid unproven cures or alternative therapies that claim to cure HIV, as these can be harmful and interfere with effective treatment. Always consult a healthcare professional for personalized advice and the latest medical information. In summary, while ongoing research offers hope for future cures, today there is no safe, effective, and scalable cure for HIV/AIDS. The best strategies for managing the condition include early diagnosis, consistent treatment, and prevention methods. Staying informed and working closely with healthcare providers can help people living with HIV lead healthy lives and prevent transmission. Remember, medical science continues to advance, but for now, the focus remains on treatment and prevention.